Hi, I'm Dr. Jason Garrett with Airrosti Rehab Centers, and today we're going to talk about carpal tunnel syndrome. Now, most people have heard of it. Pretty much everyone's heard of carpal tunnel syndrome, but very few people actually understand what's going on. Traditional ways of looking at carpal tunnel syndrome is numbness, tingling, pain, and muscle weakness in the distribution of the median nerve, which comes out in the forearm, enters the wrist, gets compressed there, and causes numbness and tingling and pain. So today we're going to look at a couple traditional ways of evaluating it and treating it, compare it to Airrosti's methods of evaluation and treatment. Let's take a closer look at where the median nerve comes from. So it starts in the neck up here. The nerves that exit the neck comes down through the shoulder, into the bicep, down to the forearm to where it ultimately goes through the carpal tunnel, which is where it usually gets irritated. If it gets irritated in here, it's going to cause numbness and tingling and pain into your thumb, your index finger, your middle finger, and half of your ring finger. If it ever causes numbness and tingling to your pinky, then you don't have carpal tunnel syndrome because the median nerve does not innervate the pinky. The good news about this nerve is it has plenty of areas that it can get irritated and cause no problems at all. So you can irritate the shoulder, the neck, the bicep, the forearm. That nerve's getting mad and irritated. It's a little bit swollen. Once it gets through the carpal tunnel, now that swollen nerve has no room to move because there's other structures in there, tendons, ligaments, nerves, bones, and fat. If it gets irritated, it swells and presses against those structures, then causes pain and numbness and tingling into the hand, even if this is not where the injury actually is. As a matter of fact, the carpal tunnel is rarely the cause for carpal tunnel syndrome. It's usually somewhere further up along this distribution of the nerve. Traditional ways of diagnosing carpal tunnel syndrome, and let's actually take a closer look at the word syndrome. Syndrome means they don't know what causes it and therefore don't really know how to treat it because they're chasing symptoms. Patient goes, gets a physical exam, the doctor focuses mostly on the patient's symptoms, then they order a nerve conduction velocity study, which tests how quickly a nerve can conduct a current, and then sometimes they do an MRI, which looks at the carpal tunnel. And all three of these things focus primarily on the carpal tunnel, which is not where the injury usually occurs. Okay, let's discuss a few of the traditional treatments for carpal tunnel syndrome. One is anti-inflammatory medications, whether over the counter or prescription. That's going to reduce inflammation, but it's not going to fix the injury. It's not going to fix what's going on further up. Two, you can have a cortisone injection actually into the carpal tunnel itself to reduce inflammation again, which is going to make it feel better. It's going to reduce the symptoms. You can go about your daily activities, but you're not fixing the problem. It's probably going to come back. And a third option, which is you want to use as a very last resort, is carpal tunnel surgery. A couple different procedures. Some are less invasive than others, but ultimately you're taking a structure that's meant to be there, you're cutting it or releasing a ligament that's there for strength to allow that nerve to swell, which then reduces the symptoms, but you've done nothing for the actual injury and you've just made the wrist weaker, and more often than not, the symptoms do come back. Now let's discuss how Airrosti assesses, diagnoses, and fixes carpal tunnel syndrome. First of all, we adhere to strict clinical guidelines in regards to orthopedic, manual, and neurologic testing. Then we spend an hour of one-on-one time with the patient where we go in and we specifically figure out where this nerve is getting irritated along the entire pathway from the neck to the fingers. Then, once we've established where those injuries are occurring, we go in and manually, using our hands, correct any irritation along that nerve and fix carpal tunnel syndrome. So if you're experiencing any symptoms of carpal tunnel syndrome, if you've been diagnosed with carpal tunnel syndrome or considering other options, you owe it to yourself to see Airrosti first and see if we can get you out of pain. If we don't make a dramatic impact in the first or second visit, we'll get you to the appropriate place. Thanks for watching.